Thank you for joining Diabetes and Medicare, What You Need to Know to Apply, the joint presentation from the Diabetes Foundation and the New Jersey Division of Aging Services. All attendees are in listen-only mode. If you have questions, please use the Q&A feature in Zoom. We will get to them at the end of the presentation. Now, it is my honor to introduce the Executive Director of the Diabetes Foundation, Janine Salente. Janine?
Thank you everyone for being with us today. It is my pleasure to welcome you to the Diabetes Foundation's workshop, Diabetes and Medicare, What You Need to Know to Apply. I'm going to begin by briefly describing the work of the Foundation before I turn the presentation over to Mary to present our workshop. Please know that we'll be approximately 1 hour and Mary will present for about 40 to 45 minutes. There will be 15 to 20 minutes left at the end for Q&A at the end of the presentation. Throughout the webinar, if you have a question, please write it in the Q&A at the bottom of your screen. I will present these questions at the end for Mary to answer. Mary, if you can turn it to the next screen, please. For the past 30 years, the Diabetes Foundation has been helping people from Bergen County through Cape May to manage their diabetes by offering free insulin, diabetes supplies, A1C testing, transportation assistance, and educational programming like our webinar today, all in an effort to support diabetes prevention and management. Our education programming alone serves more than 1,000 people per month through our webinars, Facebook Live, yoga, and low-impact exercise programs, and diabetes care videos. Our free medication assistance, supplies, and other tangible services are well known throughout the state and throughout the healthcare industry as an available opportunity to help people stay compliant with their diabetes care. The Diabetes Foundation is the only one of its kind in the state of New Jersey and beyond, helping people and their families for the past 30 years. COVID-19 has added additional concerns for those with diabetes, and finding the right healthcare to ensure you can manage your diabetes is important. We are so grateful to Mary McGeary for being here today to bring her expertise to the Diabetes Foundation participants, helping us to understand how to best apply for Medicare. Mary McGeary is the director of the State Health Insurance Assistance Program, also known as SHIP, in the New Jersey Department of Human Services, Division of Aging Services. She has been working with SHIP since 2005, where she's been involved in health insurance counseling for the aged and the disabled Medicare populations. She also provides education and training on Medicare for professionals working in social service, legal, insurance, and healthcare fields. As a director of the program, she oversees funding and training for over 400 SHIP Medicare counselors statewide. Mary, I'd like to turn the presentation over to you. Thank you again for being with us.
Hello, thank you very much for having me. Good morning, everyone. For today's presentation, I'll be talking about all about Medicare, most specifically Medicare costs and coverage. I'll talk about who's eligible for Medicare, Medicare coverage for diabetes, what's the difference between a Medicare supplement policy and a Medicare Advantage plan, talk about Medicare open enrollment, which we're currently in the midst of, and then finally programs to help with Medicare costs. So the first thing you need to know is Medicare is not one all-inclusive program. It's actually broken down into 4 distinct parts, and they're labeled by letter A, B, C, and D. Part A of Medicare is inpatient hospital coverage. Part B of Medicare is the medical insurance. And those 2 parts of Medicare together, A and B, are referred to as original Medicare or traditional Medicare. Then the other 2 parts of Medicare are considered optional. Part C is called Medicare Advantage, where you would get your hospital and medical coverage. Rather than from original Medicare, you would get it from an insurance company contracted with Medicare in the form of a managed care plan like an HMO or a PPO. Lastly, Part D is the Medicare prescription drug coverage. Now, each of these parts of Medicare, A, B, C, and D, they each have different rules for who can enroll and when you can enroll. They each have different costs associated with them. So they each have a monthly premium. They each have a deductible that you have to pay before Medicare or the plan will pay. And they each have what's called cost sharing in the form of a coinsurance or a copay every time you get a service. Eligibility for Medicare is over 3 groups. The first group is those eligible by age, and 65 is the magic number. So you're eligible for Medicare benefits when you turn 65 and older. The second group are those collecting Social Security disability who are between the ages of 18 and 65. There is a waiting period for those individuals, so if you are collecting disability, there is a 24-month wait before you become eligible for Medicare. The third group are those of any age diagnosed with end-stage renal disease are also eligible for Medicare coverage. Note, you also have to be a United States citizen to qualify for Medicare, or a lawfully present person in the U.S. with 5 years of continuous residency. Now, even though eligibility is at age 65, you don't have to enroll in Medicare at 65. So if you are still working and you have health insurance from your current employer, you can delay enrolling in Medicare because you have employer coverage. Some people like to enroll in Part A at 65 because it's free for most individuals, but delay the Part B of Medicare, which you have to pay for. So at age 65, if you are still working, and that employer is what's called a large employer, meaning more than 20 employees. So if you're working for a large employer, you can delay enrolling in Medicare until you're no longer working. Okay? So you don't have to enroll, you can delay it if you have employer coverage at 65. These are the costs associated with Medicare for 2020. The costs have not, for 2021, have not yet been announced. We expect that anytime within the next few weeks. But these are the costs for Part A, B, and D. So they each have a monthly premium. For most folks, Part A is free. While you are working, you pay a Medicare tax. And if you've worked and paid into Medicare at least 10 years, you're entitled to premium-free Part A. If you've worked for less than 10 years, you can buy the Part A premium, which is quite expensive, this year $437 a month. But only about 2% of Medicare beneficiaries have to pay for Part A. Part A also has a deductible, and that deductible applies with each inpatient hospital stay during a 90-day period. And that's a rather large deductible, $1,408. But notice I have a star next to that. Most people have other insurance besides Medicare. So your secondary insurance, whether that be a Medicare supplement policy or a retiree health plan, will pick up that large hospital deductible, either all of it or some of it. Then lastly, Part A has a daily co-insurance for inpatient hospital stays of more than 60 days of $352 a day. Part A also pays for inpatient skilled nursing facility care. So after a hospital stay, if you need to go in for inpatient rehabilitation, Medicare will also cover up to 100 days of inpatient rehabilitation. First 20 days is covered in full by Medicare. Then there's a copay of $176 per day for day 21 through day 100. So looking at those numbers, you can realize if you have Medicare only, it can be quite expensive for a hospital and inpatient rehabilitation stay. That's why most people have other insurance to help you pay those Medicare costs in the form of retiree health plan or to purchase a Medicare supplement policy. Moving over to the column for Part B. Part B also has a monthly premium. Most people pay this year $144.60 a month. If you're collecting Social Security, that's deducted out of your Social Security check. If you are enrolled in Medicare but not yet collecting your Social Security, you would pay that premium directly to Medicare. Now that premium is based on income. So if an individual is earning more than $87,000 a year, your premium would be higher. If you're a married couple and your combined income is more than $177,000 a year, your Part B premium would also be higher. Part B also has an annual deductible that this year was $198 before Part B starts to pay for services. And then in terms of coinsurance, Medicare Part B has a 20% coinsurance. Medicare covers the other 80% for most medical services like doctor visits, medical testing, or medical supplies. Last column is Part D, that's the drug coverage. Most of our Part D drug plans have a monthly premium. The average is about $37 a month. On the deductible for the Part D drug plans, some plans have a deductible, but the maximum deductible this year was $435. And then each drug you get will have a co-payment, a flat fee of $2, $5, or a co-insurance, like a 25%. Each of those prescription drug plans have a different cost share amount for the various drugs. Your Part A of Medicare, again, that's your inpatient coverage, covers inpatient hospital stays, covers inpatient skilled nursing facility care for up to 100 days if you're there for rehabilitation. Also covers home health care services, hospice care if you develop a terminal illness, and a place of blood transfused. Part B of Medicare is the largest part of Medicare, covers most things you think about with medical coverage, and Part B covers most of these things at 80%. So that's doctor's services, whether you see the doctor in the doctor's office or in the hospital or in the nursing home, Part B would pay for that. Part B covers outpatient medical and surgical services, diagnostic testing and lab tests, so things like MRIs and x-rays, outpatient therapy, physical therapy, occupational therapy, outpatient mental health services, home health care services like a visiting nurse, durable medical equipment, and that would include glucose testing machines and supplies, outpatient hospital services, and ambulance services, all covered under Medicare Part B, most of them at 80% coverage. Now for COVID, Medicare has full coverage for COVID testing and treatment. So Medicare is covering COVID testing at 100%. And if you do develop COVID, Medicare covers you for COVID treatment. So if you have to go to the hospital, Medicare Part A would cover the hospital costs. If you need to take any prescriptions for COVID treatment, Medicare covers that. If and when a vaccine is developed for COVID-19, Medicare announced yesterday they will cover that in full. There'll be no cost sharing for a COVID vaccine. And then the big treatment now because of COVID in most insurances, including Medicare, is availability of telehealth services. So you can receive services from your doctor or physical therapist or mental health professional via telehealth, and Medicare will cover those services so that you don't have to go out and expose yourself during this pandemic. So now specifically, I want to cover the things that Medicare covers for folks that are diabetic. So this chart is available also from a Medicare publication that I'll reference at the end. So just quickly going through this, anti-diabetic drugs, that would be covered under Part D drug plan with Medicare, covers the common medications to control your blood sugar like metformin. And your cost share for that would differ depend on whatever Part D drug plan you're enrolled in. Diabetic supplies, if you use insulin, that would be covered under Part D drug plan as well. And supplies and equipment for injecting the insulin. If you are testing your blood sugar, that's covered under Part B. They cover blood sugar testing monitors and the supplies, or an infusion pump if you use insulin in that format, all covered under Part B at 80% with 20% cost share to you. Insulin is through the Part D drug plans, but if you use an insulin pump, that's through Part B as a boy, piece of medical equipment covered at 80% by Medicare. As already mentioned, the continuous glucose monitors, Part B also covers them, for those meeting certain criteria where you have to test your blood sugar 4 or more times a day. Glucoma tests are also covered under Medicare as a medical benefit Part B, covered at 80%. Foot exams and treatment for folks with diabetes considered at high risk for those foot conditions would be covered by Medicare as well. Therapeutic shoes and inserts. And then yearly wellness visits and flu and pneumonia shots. That's covered for everyone on Medicare. And Part B covers those at 100%. There's no deductible or cost sharing for wellness visits and flu and pneumonia shots. Lastly, if you are pre-diabetic, Medicare covers diabetic screenings under its Part B. Medicare has a very good diabetes self-management training program covered under Part B as a medical benefit, where you can go to a trained and certified professional to help you do self-management of your diabetes. A doctor would have to write a prescription for this, but up to 10 hours of training is provided under a Medicare covered service such as that. Also, Medicare covers medical nutritional therapy services. Again, you do need a doctor's prescription for that, and Medicare covers that at 100%. Very important to get a flu shot for everyone, but particularly for diabetics. Studies have shown that people that have to be hospitalized because of the flu have a high percentage of hospital needs for flu if you develop the flu. So please get your flu shot. Medicare covers the flu shot at 100%. Also important to know what's not covered by Medicare. This is a long list and just a very brief list. So the first three things there: eyeglasses, routine dental care, and hearing aids, right? So common things older people need that are above the neck, I always say, not covered by Medicare. Long-term care in a nursing home, home health aid. If the only thing you need is help with bathing and dressing or housekeeping, that alone is not covered by Medicare. Cosmetic surgery, acupuncture, though they have just approved acupuncture treatment for low back pain. Foot care from podiatrists, but with diabetes, you would meet that exception to have podiatry care. Non-emergency medical transportation not covered. Home modifications like a ramp, so Medicare will pay for you to have a wheelchair, but will not pay for a ramp to be installed to get in and out of the home. Medicare also does not cover care outside the United States. Now, if you are in original Medicare, these things are not covered, but if you enroll in a Medicare Advantage plan, which I'll talk about in a moment, or if you're very low income and covered by Medicare and Medicaid, many of these type of services are covered through Medicare Advantage plans and or Medicaid. So there are two ways to get your Medicare coverage. The one on the left is called Original Medicare, A and B, that I just reviewed. Or you can get all of your Medicare benefits through a Medicare Advantage plan that combines all the benefits into one plan. So I highlighted what Part A and Part B covers already. And I did talk about all those deductibles and cost sharing in Part A and Part B. So now I want to talk about Medicare supplement insurance plans. So some folks don't need to purchase a Medicare supplement if you have a very good retiree health plan that acts as the supplement to Medicare. But if you don't have retiree health insurance, you might want to consider purchasing a Medicare supplement policy. These policies are sold by insurance companies, and we have about 24 companies selling them in New Jersey. They cover the cost gaps in original Medicare. So they don't cover the things that Medicare doesn't cover, like eyeglasses and hearing aids, but they help you with those Part A and B deductibles and copays. They go by the name of either Medigap or Medicare Supplement Insurance. The policies are labeled by letter A through N, and they're considered standardized. That means that a policy N from Horizon has the exact same benefits as a policy N from Aetna or United Healthcare. So the policies in terms of the benefits are identical, but each company offers those policies at different premiums, and they formulate those premiums in different ways with different factors. When you have original Medicare A and B and a Medicare supplement policy, you have the freedom to go to any Medicare doctor, hospital, or provider that accepts Medicare in any state in the nation. So it gives you the most flexibility to go wherever you want for your medical services. Medigap policies do have a cost associated. There's a monthly premium that you pay in addition to that Part B premium to Medicare. The premium's going to differ based on how old you are and what plan you choose. So these policies are based on age. So the younger you are, the cheaper the policies, but they will increase every year as you get older. Right now, the premium range is about $100 a month if you're 65. It's closer to $350 a month as you get closer to age 80. Medicaps pay claims after Medicare pays, so they're secondary insurance, and they do only cover the things that Medicare covers. The most important thing you need to know about Medigap policies is the best time to buy it is when you are new to Medicare. When you start your Medicare Part B, the first 6 months you have Medicare Part B, all of the insurance companies selling Medigaps here in New Jersey have to take your application and have to issue you a policy at the best rate that they can. That's called your Medigap open enrollment period. If you waited until beyond your 6 months of Part B, then your application is going to have medical questions on it. And a company can either charge you more for the policy because of your pre-existing conditions, or they could outright turn you down for a policy. So you want to get a Medigap policy as soon as you start your Medicare Part B to avoid being turned down. These Medigaps also do not cover prescription drugs, so you would need to get a separate Part D drug plan to work with your Medicare A, B, and your Medigap policy. This is a chart we have on our Division of Aging website. Shows you the different letters of Medigap policies here. You see letter Medigap A through F, and it tells you which of the Medicare cost sharing they cover. So again, we don't have our 2021 Medicare costs yet, but it shows that Part A cost, the deductible, the hospital copays, a Part B deductible and the 20%. So right now, if you're new to Medicare, turning 65 this year, policy G in the middle there has a star in every single box except for the Part B deductible. So Medigap Plan G would be the most comprehensive Medigap policy you could buy now. The two policies on the right, Plan C and Plan F, those are policies only sold to people who started their Medicare before January 1, 2020. If you're turning 65 after that, you cannot get Plan C or F. That's under federal law changes that were made. So I talked about Medicare Part A and B and Medigap policies. Now I want to talk about Part D prescription drug plans. You can get prescription drug coverage from Medicare in one of two ways. You can get a standalone prescription drug plan referred to as a PDP. These policies are offered by insurance companies that contract with Medicare to offer this benefit, and it only covers prescription drugs. Another way to get it is by joining a Medicare Advantage plan. Those are plans that provide both medical and drug benefits. Lastly, you might get credit for having drug coverage from somewhere else. So maybe you're retiring with retiree health benefits that also includes a drug benefit, or maybe you belong to a union and your union has a drug benefit program for you. If that benefit is as good as or better than the basic Part D plan under Medicare, you get credit for having that, and you don't need to get drug coverage from Medicare. For the Medicare Part D drug plans, each plan has a list of drugs that they cover, and that list is called a formulary. And we have 30 drug plans to be offered in New Jersey. So each of those 30 plans has its own unique formulary of drugs they cover. They must cover medications in most of the medical class of drugs. There are some exclusions to it, but not every plan will cover every medication in every class. So you need to carefully choose your plan to make sure it covers the medications you take. Within the formulary, the insurance companies place their drugs into cost tiers. Normally, each plan has 1 to 5 tiers, with the lowest tiers having the lowest copay. There are some categories of drugs that Medicare does not cover under Part D. Those include prescription vitamins, cosmetic medications like Rogaine for hair growth, other class of drugs they call lifestyle drugs, that would be the Viagra class of drugs. So there are some things that Medicare Part D will not cover for medication. For the Medicare Part D drug plans for 2021, we do know their cost parameters for those. Of the 30 plans we have, there's a large range. The monthly premium ranges from a low of $7 a month up to $97 a month, with the average Part D drug premium being $37 a month. Some of the plans have a deductible, some do not, but the cap on the deductible for next year is $455. After the deductible is met, you go into what's called the initial coverage period, where you pay a copay at the pharmacy counter for each medication, and the Part D plan will pay the balance. You're going to stay in this initial coverage period until the total amount of drugs you receive for the year reaches $4,130. So some people never hit that cap. They might take inexpensive medications, but many people do hit that cap, particularly many people on insulin will hit that cap. So if they hit that cap, they go into the next level called the coverage gap, which as soon as Part D came out, they called this the donut hole. If you're in the coverage gap from your Part D plan, then you pay 25% of the cost for each generic or brand name drug that you get. You're going to stay in the coverage gap until your out-of-pocket cost for the calendar year reaches $6,550. Now note that not all of that $6,550 comes out of your pocket. Any brand name drugs you take during the coverage gap, you're getting a discount from the drug manufacturer, and that discount counts as if it came out of your pocket. So that is a large figure, but not all of it's coming out of your pocket. The final phase is called the catastrophic benefit, and only about 5% of Medicare beneficiaries reach that amount. But if they do, then you pay a small copay for each prescription until the end of that calendar year. Now, this is quite confusing, this part of the Part D. You will get a monthly statement from your Part D drug plan telling you exactly where you are in your coverage phases. So list all the drugs you got for the month, how much you paid for, how much the Part D plan pays for, and how many more dollars you need to spend before you hit the next level of the benefit. So for 2021, we have 30 Part D plans available here in New Jersey. That low-cost plan is offered by SilverScript Smart RX with $7.30 a month. Then we have some other plans that are under $20 a month premium. So those, are rather affordable. If you have Medicare right now and you currently have a drug plan with Envision, please note that plan is changing its name to Elixir next year, and the premium is jumping up to $55.90 a month. So you really want to shop around for another plan if you're in Envision right now. Also, if you're currently in a Part D plan with Mutual of Omaha and you have their value plan, that plan is ending and it's moving all of its members into another Mutual of Omaha plan called RX Plus with a $97 a month premium. So you also want to do some shopping to change to a lower cost plan. Lastly, if you have a SilverScript Part D plan now, note that those plans have been taken over by Aetna, but your plan will still keep the SilverScript name. What's very exciting for 2021 is Medicare has rolled out a test called the Part D Senior Savings Model, where they're testing savings for the cost of insulin in its Part D benefits. Plans that are participating in this will offer insulin for a maximum copay of $35 a month for a 30-day supply. And that $35 copay will be for most of the calendar year. You'll pay the flat $35 even if you're in your deductible phase, your initial coverage phase, and even in the coverage gap, you'll pay the $35. Only if you hit your plan's catastrophic phase will your costs go up then to the 5% of the cost of the insulin. 9 of our 30 Part D plans are participating in this insulin savings model for next year. And some of our Medicare Advantage plans are also participating. That includes the United Healthcare plans, Braven Medicare Advantage plans, and 2 of the Humana plans are participating in this program. This insulin savings program includes insulin made by these 3 pharmaceutical companies. And it includes all forms of insulin, rapid-acting, short-acting, and long-acting. It includes the common insulins, Humalog, Humulin, Novolog, Novolin, and Lantus. But what's very important for you to understand is not all insulins will be on a plan's formulary. Each insurance company decides which of those insulins they want to include on its list of drugs to be covered, and which of those insulins will be the $35 model. Actually have to carefully shop around among the plans to see which ones participate, if that's going to be the best plan for you. When you're looking at Part D plans, the way to compare them is to look at the coverage first, not the cost. So it's not you can't assume that that $7 a month plan is the best plan for you, because it may not have your drugs on its formulary. So coverage is most important. You want to look at which plan has all of your prescriptions on the formulary, without any type of restrictions like step therapy or prior authorization. Then you want to look at the cost. And the cost is not just the premium. You want to look at your cost to be in the plan for a whole year. That includes the premium, the co-pays, and all the deductibles. That's called the total estimated annual cost. And you can find that cost on the Medicare website, which we'll talk about in a moment. The other factor is convenience. Many of the plans have a pharmacy network, and within that network, many of the plans have preferred pharmacies. So for an example, a plan like the Humana Walmart Medicare plan, you can go to CVS or Rite Aid or the ShopRite pharmacy with that plan. But if you go to Walmart, that's their preferred pharmacy, you'll save about $10 per prescription. So it's worth it taking a look at the preferred pharmacies in the plan. The other factor is coordination. If you have other help paying for your drugs, like our state assistance program, they only work with certain Part D plans. Medicare on its public website, medicare.gov, has something called a plan finder. And you can use this tool to shop around both the Part D plans and the Medicare Advantage plans. So the website is medicare.gov, G-O-V. Please do not go to medicare.com. That's an insurance company going to try to sell you something. So it's the official government website, medicare.gov. There you'll find a link to Find 2021 Health and Drug Plans. You can use this plan finder to type in your list of prescriptions, and then it'll sort through all of those 30 Part D plans and tell you which plan has the lowest total out-of-pocket cost for you based on your prescriptions. Now, the other thing you can do here is log in or create a My Medicare account. And when you create a My Medicare account, all your list of prescriptions should already be in there, and you don't have to type them in. This is a sample of what you would see if you typed in your prescriptions on the Medicare Plan Finder. So you see this is information for the Clear Spring Health Premier RX plan. And it's showing you that CVS is the preferred pharmacy for this plan. And the drug I entered is Lantus 100 units pen injector. You see here that the cost before the plan's deductible, right, in this plan for a 1 month supply of Lantus would be $416. After you met the plan's deductible, so you would pay that in January. Then your deductible would be met, and the next month, you would then pay a $40 copay for Lantus, because you're in your initial coverage period. You're going to stay in this initial coverage period for several months until you reach the plan's coverage gap. In the coverage gap, you then pay the 25% of the cost of Lantus, which would be $104. And if you were to reach the plan's catastrophic benefit, then your costs would go down again to $20. The plan finder estimates when you're going to reach the coverage gap. So in this example, the person would reach the coverage gap in October. So you would pay that $40 copay from February until September, and then in October, you would hit the coverage gap. Okay, so the plan finder is a very good source of information to both find the best coverage and to let you know what your costs are going to be. This plan, the Clear Spring plan, has a monthly premium of $13.50, and the costs on this do not include that premium. So it is suggested that you were to create a My Medicare account when you are new to Medicare to help you both keep track of your Medicare claims and to also help you with those plan comparisons. Again, it's the government website, so it's mymedicare.gov. You'll see all your hospital and medical claims if you're in original Medicare there. And if you're already in a Part D drug plan, your list of prescriptions will automatically show up. We have a 5-minute video showing you how to create a My Medicare account screen by screen that is found on YouTube and is linked on our state SHIP website. If you do join a Part D plan, you usually lock into that plan for the whole year. It can't change until the next open enrollment period. But if you get a new prescription during the year and you find that your Part D plan doesn't cover it, what are your options? The first option is to switch to a similar drug that is on the plan's formulary. So your doctor can then, you check with your doctor to see if you can safely switch to a different medication that the plan covers, and simply then switch to one that your plan covers. If the doctor says that that prescription is the best one for you, that the other ones the plan covers would not work as well, that doctor can work with your Part D plan and request what is called an exception, that the plan covers that drug just for you because you can't take the alternatives. If an exception is approved, normally the plans will put it in a higher cost tier, which you can also appeal. But if you request an exception and the plan turns it down, there are 3 other levels of appeal that you can go through to try and get the plan to cover it. If the plan still will not cover it, then the next time you can change plans is during the annual enrollment period in the fall. So what I really just want to emphasize here is never walk out of the pharmacy paying full price for a medication without having to first ask why the plan did not cover it. It might just be that you're in your deductible phase and that's why it's not covering that month. Or maybe it's not covering it because maybe prior authorization is needed first, some information from your doctor before the drug plan will cover it. Or then it might be that it's not on the formulary and you should go through the motions to request an exception. Particularly if there's a valid medical reason why you need to switch to something else. It can just be a simple phone call or a simple fax over sheet that your doctor can do to the Part D plan to get it to cover the drug that you need. So I talked about original Medicare, Part A and Part B, adding a supplement to it and adding a Part D drug plan to it. The other option you have is to get all of these services instead from one plan called a Medicare Advantage plan. Those plans combined your hospital coverage, your medical coverage, and your prescription coverage all together in one plan. You have this option to decide whether you want original Medicare or Medicare Advantage, both when you're brand new to Medicare, and then every year in the fall, Medicare has an open enrollment period where you can switch from one type of coverage to another. These Medicare Advantage plans are structured as managed care, so they're HMOs or PPOs. They're offered by insurance companies that contract with Medicare, and they're the same type of insurance companies that also offer Medicare supplement policies and Medicare Part D plans. So you always have to be careful to know what type of coverage you have. When I work with clients and I ask them what coverage they have, they'll say, well, I have Aetna. I say, well, is it an Aetna Part D plan, an Aetna Medicare supplement plan, or an Aetna Medicare Advantage plan? And most times folks don't know. So they have to look at the ID card then to see. The ID card will tell you what type of coverage you have. When you enroll in a Medicare Advantage plan, you must get all of your medical and prescriptions through the plan. No claims can go to Medicare. You're going to put your Medicare card away and only use the Medicare Advantage card for services because that's where the claims will go. Whereas with original Medicare and a supplement, I said you have the freedom to go to whatever doctor you like anywhere in the country. With a Medicare Advantage plan, you now have a network of doctors to follow. So you can only use specific doctors, hospitals, and labs that are contracted with your Medicare Advantage plan. You also might need a referral from your primary doctor before you can go to a specialist, and you might need prior authorization from your plan before you get certain testing and services. The advantage part to Medicare Advantage is that these plans offer extra benefits that original Medicare does not. Things like eyeglasses, hearing aids, and dental care are offered in most Medicare Advantage plans. But do remember, these do not supplement Medicare. Instead, it's a different way to get your Medicare benefits. When you join a Medicare Advantage plan, you still pay your Part B monthly premium to Medicare, and then some plans charge an additional premium for the Medicare Advantage, although we do have a good number of them that are a zero monthly premium. The cost sharing in a Medicare Advantage is different than original Medicare. Instead, when you join a Medicare Advantage plan, you'll pay a fixed copay or co-insurance for every service, and it differs from plan to plan, right? So one plan might have a $20 copay to see your primary doctor. Another plan might have a $5 copay to see your primary doctor. They differ from plan to plan, so it's a little bit more difficult comparing plans on the Medicare Advantage side of things. Many of the plans now have really expanded the amount of extra benefits or supplemental benefits that they offer. Many of them are now offering comprehensive dental benefits rather than just coverage for cleanings or checkups. Many of them are offering things like home-delivered meals after a hospital stay. And many are offering an over-the-counter spending card that you can buy things at the local pharmacy like cold medicine or shower chairs or adult diapers. Some of them including transportation to medical appointments, and many of them are offering worldwide emergency coverage. To find out more details about a Medicare Advantage plan, you want to go to the plan's website and look at the document called the Summary of Benefits. That'll have the details on all of the things they cover and the cost share for all of those services. Always ask questions before joining a Medicare Advantage plan, because now you are paying different costs and are limited to where you can go. So the most important question is the network. Are my doctors and hospitals that I like to use in the network for the plan? Take a careful look at what the cost sharing is for each type of service, like physical therapy or outpatient procedures. Know that if you do want to go out of network, does the plan have coverage for that? And what will it cost you? Many PPO plans, if you go out of network, will only cover you at 40 or 50%. Know if referrals are required. And also, most importantly, look at the drug coverage. If you join a Medicare Advantage plan, you must include prescription benefits as part of it. You can't get a separate Part D plan. You also, what is new for next year is Medicare Advantage plans can now enroll people with end-stage renal disease. That was prohibited before that. So now you can join any Medicare Advantage plan if you have end-stage renal disease. But do note that most of those plans have a 20% co-insurance for dialysis, which can be quite expensive. But you are protected by the plan's maximum out-of-pocket. After you hit the plan's maximum out-of-pocket, then the plan will cover you at 100% until the end of the calendar year. So the annual enrollment period for Medicare is October 15th to December 7th. This is the time of year to join or switch Medicare drug plans or Medicare Advantage plans. It's not the time of year to enroll in Medicare A or B. There are different rules for that around when your birthday is or when you stop working. You want to shop for plans every year because the plans do change in terms of their cost and their coverage. You also have another opportunity if you're in a Medicare Advantage plan to change that between January 1 and March 31st of every year. You can switch from one Medicare Advantage plan to another, or you can leave those plans and return to original Medicare. Now, I just want to briefly talk about some of the plans we have, programs both on the federal and the state level to help you with Medicare costs if you have a limited income. The first one for very low income individuals is Medicaid. And here in New Jersey, that's called New Jersey Family Care. So eligibility for that is based on your income and your assets. Income, they look at all gross amount of money coming in. So that would mean your Social Security checks, your pension checks, if you're still working, your employment. So all sources count. On the asset limits, they look at savings account, checking account, IRAs, certificates of deposit. They do not look at the value of your home for this considered as an asset. If you qualify for help from Medicaid, they'll pay all of your Medicare costs. They'll pay the monthly premiums, the deductibles, and the cost sharing. To apply for Medicaid, you go to the County Board of Social Services. We also have a program that helps pay that Part B premium. So if your income's a little bit higher, you don't qualify for Medicaid, you might qualify for this program called SLMB, SLMB. That also has an income and an asset or a resource test. If you qualify for help at SLMB, they'll pay that Part B deductible for you. And you apply for SLMB at our Division of Aging website or by calling the 800 number for an application. We also have 2 pharmaceutical assistance programs in New Jersey. First one is called PAD, P-A-A-D, with a much more generous income eligibility guideline there, and there are no asset or resource tests for this program. If you qualify for this, the PAD program will pay your premium for your Part D plan and all your deductibles and copays. You pay $5 for each generic, $7 or less for each brand name drug at the pharmacy counter. It also covers coinsurance for any Part B drugs that you take. We also have another program called the Senior Gold Prescription Discount Program with an even higher income eligibility limit and no resource requirement. PAD will pay up to 50% of the cost of each prescription at the pharmacy counter. To apply for any of those programs, SLMB, PAD, or Senior Gold, it's one application called NJ Save, and you can apply online. You just have to Google NJ Save or go to our website, aging.nj.gov. They also screen for other programs like help with heating and utility bills. So to get more help about Medicare, particularly now in open enrollment, if you're already on Medicare, you can use that Medicare Plan Finder at medicare.gov. You can call the plans directly to ask questions or enroll. You can also call 1-800-MEDICARE. That Medicare line is open 24 hours a day, 7 days a week. You can also get charts of the New Jersey plans, the Part B plans, the Medicare Advantage plans, the Medigap policies on our state website, or you can call us at 1-800-792-8820. The program I work with is called SHIP, S-H-I-P, State Health Insurance Assistance Program. We are available to help whether you are new to Medicare or now already on Medicare, but need help during open enrollment to compare your coverage and to take a Part D plan and know what Medicare Advantage is. Open enrollment again ends December 7th. And we have come up with creative ways to assist folks during this COVID pandemic. We can assist you over the phone or with a virtual meeting via Zoom or by email or by phone. So please give us a call to see if we can help you during open enrollment or when you're new to Medicare to help answer your questions. We are a free service. We're funded by the federal government. And we have, as Janine mentioned, over 400 counselors available statewide to assist you with your Medicare questions. Some other resources, that document I talked about before, Medicare coverage for diabetes, is available free online. And also more information about the Diabetes Self-Management Program. That is a very, very good workshop for how to manage your diabetes with sessions right now virtually all over the state available for you. I believe you're going to get access to these slides when we are finished. Okay, so that wraps it up. Janine, do we have any questions?
We do have questions. Thank you so much, Mary, for that very informative presentation. We have a number of questions. I will jump right into them. Some of them came before you spoke about the content within your presentation, but I'm sure there's more that we can add. The first question is, are diabetes self-management classes being offered virtually? And if so, will Medicare cover?
Yes, so they are being offered virtually. They are sponsored by various organizations throughout the state that do that. So on the slide that you see on your screen on the bottom is the link at our State Department of Human Services website. We'll have a list of sessions that are available and whether they're offered virtually. Medicare does cover, as I said earlier on, these diabetes self-management program is covered under Part B for education. It's also covered through Medicare Advantage plans as well.
Great, thank you. And we have the list at the Diabetes Foundation Inc.org website as well. We have a link with a list of all of those sessions throughout New Jersey. Next question, what if you need more than 10 hours of education a year?
Well, you can discuss that with your physician about some other education programs that might be available. Medicare will only pay up to that limit, but there might be some other free sessions available about education. Our Division of Aging Services also have what they call a chronic disease self-management program that includes help for folks with diabetes. That's free sessions as well that are peer-led. So I would always call your local county office on aging to see what else is available and speak with your physician to see what other training services are available after the Medicare coverage has tapped out.
Thank you. The next question is, you had mentioned early on in the presentation that Part D plans work with the state assistance program. Does this mean PAD? Can you discuss this
Yes.
more and explain? Okay, great.
Yep. So the Part D plans do work with PAD. PAD will pay the premium for, I believe, 8 plans for next year. So if you already have PAD, PAD will make sure you're in the right plan to cover your prescriptions and a plan where PAD could pay the premium for you. So if you're already on PAD, give PAD a call. They can answer any questions about what plan you're in or if they're going to move you to another plan.
Thank you. The next question is, for the most flexibility if you travel, what is the best type of plan to get in case you need to go to a hospital or a doctor that is out of state?
Okay. So many of the Medicare Advantage plans now have a travel benefit where, for instance, the national insurers like Aetna, United Healthcare, Horizon are part of a national network. So many of those Medicare Advantage plans now offer a travel benefit where you can see network providers in any other state. So you want to look for a plan that has that travel benefit if that's the case. For emergencies, all Medicare Advantage plans have to cover you for an emergency room visit at a hospital, no matter where you are in the United States. So again, Medicare and Medicare Advantage only cover within the United States. Some of them cover outside the U.S. in terms of Medicare Advantage. So if you travel a lot within the U.S., look for a Medicare Advantage plan with a travel benefit. You don't have to worry about emergencies because they do have to cover you for an emergency. If you're traveling outside the United States, then you want to look for either a Medicare Advantage plan that has worldwide emergency coverage, or if you're in original Medicare with a supplement, some of the supplemental plans have a travel benefit. I'm going to scroll back to my slide there a little bit. My star chart that I used, some of them, here we go. So you see on the chart on the screen now, the very bottom row says foreign travel emergency coverage. So some of those Medigap, like a Plan D and a Plan G and a Plan M and N, have foreign travel emergency coverage. So if you do travel and want original Medicare, make sure you get a supplemental coverage that has that travel benefit. Lastly, some people that do just buy a separate travel emergency policy. that are quite inexpensive to cover you for any types of emergency outside the U.S.
Thank you. That was really informative. We have about 5 minutes left and 3 more questions. The first one is, are income limits you listed for extra help for 2020 or 2021?
That's for 2020. They don't update for PAD and Senior Goal. They've not yet updated their limits, but it will. Their limits will increase by 1.3% because that is the Social Security cost of living adjustment for next year. So the PAD limits will go up by 1.3%. For SLMB and Medicaid, those don't change until about February of next year because they go by the federal poverty levels. So that's, we know those new limits until about February.
Thank you. Last 2 questions. What is the difference between co-pays and co-insurance?
Oh, excellent question. So a copay is a flat fee. So if you join a Part B plan that has a $5 copay for Tier 1 drugs, you will always pay $5 at the pharmacy counter during that plan's initial coverage limit. So it's the same amount of money every time you get the service. Coinsurance is a percentage. So some Part D plans have a 20% copay for a Tier 3 drug. So in that case, every time you go to the pharmacy, you're going to pay something slightly different because the cost of medications do fluctuate, like the cost of gasoline. Okay? So a copay is a flat dollar amount you pay each time for service. A coinsurance is a percentage of the cost of the service.
Great, thank you. And our last question is, why is insulin with a pump under Part B and with a pen or syringe Part D? Do the prices change? Okay,
so an insulin pump is reusable. So that's considered a piece of durable medical equipment, or DME. And all medical equipment devices are covered as a medical benefit under Part B as in boy. Insulin, and because you then inject the insulin with a syringe that you don't reuse, that's not durable medical equipment. So they put that under the Part D drug benefit. So how you administer your insulin will indicate which part of Medicare is going to cover it. If it's used with the durable medical equipment like a pump, which you reuse, then it's a medical device Part B as a boy. If it's an insulin that you inject and then throw away that syringe, then it's D covered, D for drug. And it does affect the prices because if you're using an insulin pump, then it's then covered under Part B, covered at 80% by Medicare. If it's in a Part D plan, the prices are going to vary all over the place because each insurance company under Part D negotiates differently for the cost of those insulin.
Well, thank you. That was the last question. Thank you, Mary, so much for providing this presentation to us. And thank you all from the Diabetes Foundation staff and trustees for getting on our webinar and learning more about how to apply for Medicare. As Mary said earlier, please contact her if you have additional questions. You can also contact the Diabetes Foundation at 201-444-0337 or look on our website for a multitude of different webinars and information at www.dfiinc.org. A special thank you to everyone today. We're having a robust series of presentations for Diabetes Awareness Month in November, so please check our website for all of the new webinars coming up. Thank you all for being with us.